Almost everybody in Massachusetts has some kind of health insurance, but they also have many problems with getting adequate health care. That's the message of a new survey by the Blue Cross Blue Shield Foundation. To tell us about the survey is our guest, the foundation's president, Audrey Shelto. Thank you very much for being with us, Audrey.
Thank you for having me.
First of all, talk about the care itself, the problems that people told you they have with getting what they need.
Sure. People talked about having trouble finding a provider who would accept their type of insurance. People talked about having trouble finding an appointment when they needed an appointment, and they particularly talked about primary care, dental services, and primarily those two areas.
Well, primary care is increasingly important in any kind of managed care because they're the gatekeeper for everything else you're going to need. And yet, this is an old problem. Why has it not been solved yet?
It is an old
the
problem.
Turnover in these
right.
care docs.
Right. No, it's a real problem because, as you said, there's more and more even emphasis on getting primary care prevention and using primary care as a much more comprehensive basis for other needs. Some of I think what's happening is we've got fewer and fewer physician students doctors who are in school going into primary care. They're choosing higher paying specialties instead. Some of it is geography. There are different parts of the city or the country city or the state where it's worse than others. But it's a very challenging problem in the Commonwealth, and it is not getting better.
Is there some way to restructure the workload? I mean, it's great to have a real doctor who knows all they're supposed to know, but are there ways to maybe break that down so some of it can be done by other kinds of people?
Absolutely, and I think that's the movement towards global payments and the delivery system reform that's going along with that is really talking more about trying to provide incentives for practices to have team-based care. So you have a lot of services that a nurse practitioner can provide or a physician assistant, so that perhaps there's ways to focus on needing to see an actual MD only for certain, more acute conditions. So there's a lot of delivery system reform that can help alleviate the problem.
Of course, maybe the biggest barrier is the cost of care. First, tell me what kind of things people are doing to keep up with the cost.
Well, unfortunately, what the survey says is that, first of all, that over 40% of the people that we surveyed reported that affordability was a real challenge in terms of them accessing health care. And several, different percentages, depending on what the measure was, talked about avoiding care altogether, not getting care that they thought they needed, cutting back on other expenses, food, heat, other expenses in order to afford medical care, running up medical debt, so having significant debt that they otherwise wouldn't have incurred. So unfortunately, the options that people are facing when confronted with what they perceive as unaffordable health care are not good.
Well, those rising co-payments and deductibles are the symptoms, but what do you think the problem is?
Well, and even with the co-pays and deductibles, it's not clear from the work that we've done so far how much of the problem is that. That is definitely part of the problem, especially for people who are working and may still be low income but have jobs and have employer-sponsored coverage that does have copays or deductibles. But we found that even people with very low income levels, people who are at 138% of the poverty level, who would be eligible for at least, and probably most of whom would have Mass Health as their coverage, the public Medicaid program, where there are very small and very few copays, still find themselves facing significant affordability challenges. So the affordability issue is very complex and one that we really have to dig in deeper to figure out how much of it is copays or deductibles, how much of it is sort of gaps in what's covered by some of these plans, whether they're commercial or public, how much of it is perhaps not a full understanding on the part of consumers about what is covered. So it's almost a fear of costs, but not yet, tested in reality. So I would say we don't yet know enough about what's really driving this very significant portion of the population that are saying healthcare costs are a major problem for me.
Yeah, and I'm thinking it could be maybe a single parent who has trouble going to appointment because there's no one to take care of the kids, or
Absolutely.
maybe they can't leave their job. And
Absolutely, especially when you look at the lower income people that we surveyed, there are a lot of other factors that present barriers to accessing care. As you said, it could be transportation, it could be childcare, it could be an inability to get away from work. One of the other findings in the report that was surprising and disturbing to us is that even though we've got such high levels of coverage, and even though actually a pretty high percentage of people say they have a regular place they go for care, still there are a lot of people using emergency rooms for situations that are not emergent, for something that could theoretically wait till you got to a doctor's appointment. And again, we need to dig deeper into this, but I would bet that some of what's driving that is, again, people can't get away from work in the middle of the day. Some people can't get away from work in the middle of the day, and it's, if their practice doesn't have hours that go into the evenings or weekends, they're going to end up at the emergency room.
This year you asked about dental care. What did you find?
We found that almost 73% of the population that we surveyed had dental insurance. I don't know whether, my first reaction was only 73%, and then I thought, well, that's actually a pretty high number. We unfortunately don't have national benchmarks for that. We've gone back to the researcher to say if we can, if she had them, and we don't have those available. So again, an area where I think we need to dig in deeper, and that is, I'm glad you raised that, that is the other area where people end up reporting that they're not getting the care that they need.
And of course, dental care, there are a lot of things, and I'm certainly an expert on this, which is putting off things. And sometimes the things that get put off get a lot worse and more expensive.
Absolutely, and I think dental care is, again, not something we've studied specifically, but certainly there are a lot of other studies that talk about how important oral health is as connected to the rest of your body's health, and that if you don't maintain good oral health, it makes for complications in the rest of your health. But almost in any situation, if you're not getting preventive screenings, if you're not maintaining what you need to maintain in terms of a chronic condition, it's going to lead to more critical problems and more expensive problems.
Thank you very much for being with us.
Thank you very much.
Audrey Shelto from the Blue Cross Blue Shield Foundation.